And when we look at bone, we can study it in two different levels. We can look at the gross or macroscopic level, what we can see with the naked eye. So in this case, we're talking about it as with the naked eye, we're thinking of it as a specific anatomical structure, such as the mandible or the maxilla. So we're looking at specific bones that we can see with the naked eye that make up our skeletal system. Does anybody remember how many bones are in the skeletal system?
Is it 206?
Yeah, good. 206. You're right. So we'll be focusing on just the alveolar process part of the mandible and the maxilla. And then in your head and neck anatomy, you're going to look at all the other anatomical landmarks like the coronoid process and the condyles. Our focus will be on that alveolar process, what we can see with the naked eye, and apply that to x-rays. Okay, and because this is histology, we're also going to be looking at bone at the microscopic level, and that'll be covered next week. And at the same time, we'll be studying cementum. We're going to see that microscopically they have similar characteristics, although there are some differences. So at the microscopic level, we are going to look at bone as a specialized connective tissue, which is mineralized, having those hydroxyapatite crystals. So I want you to realize that when you hear that term osseous tissue, that's also referring to bone. So this is just an example of a microscopic view of bone. So we're going to look at it at two levels, the macroscopic level and the microscopic level. Yeah, I just got a text that said the system is down still. So they said they're working on it. Did you guys get that text too?
Yeah.
Yes.
Oh, yeah, okay. So if you don't have the outline, just really, just maybe try to listen and take down a few notes as best as you can. Okay. Moving on to, let's review the two main types of bone. So up in that shaded box, anybody what are the two main types of bone that can be distinguished? And this is at the macroscopic or the microscopic level. Does anybody remember the two types? I know you know these.
Is it the compact and spongy bone?
Okay, great. Yes, very good. So we're going to be looking at the compact and spongy bone. And then just before I move on, I just wanted to say that even though you look at a bone with the naked eye or you look at a slide microscopically, you're just capturing it for that moment in time. In a living person, bone is a dynamic tissue. It's constantly changing. It's in a constant state of flux. It doesn't remain exactly the same as we see when we just look at a actual bone from a skeleton or looking at a slide under the microscope. Okay, so the first thing we're going to compare compact bone with spongy bone. So in the two shaded boxes at the top, just write in compact bone and spongy bone, and there's a little chart there to compare them. And I'm going to make it clear what lamellae are too. Lamellae just means bone that forms in layers. Okay, does anybody remember another term before we compare and contrast these types of bone, Does anybody remember the different names for compact and spongy? Anybody want to take a shot at it? All right, well, another term for compact bone is cortical bone. You're going to hear the terms the cortical plates of the mandible, the buccal and lingual cortical plates. So compact bone is also known as cortical bone. And spongy bone has a couple of synonyms. It's also known as cancellous bone, as well as trabecular bone. So again, just make sure you're familiar with the different terms that mean the same thing. Okay, so let's define compact bone. Compact bone is dense, solid bone. So when you just look at this, like I said, this area of the mandible, this buccal plate of bone is all compact bone. It's a dense, solid bone, whether I look at it with the naked eye or under the microscope. So we can't see the layers with the naked eye, but microscopically, the layers are arranged tightly together with no apparent spaces. So lamellae just refers to the layers. Lamella means one layer, lamellae means the plural for layers. And we're going to see that there are what we call longitudinal and concentric lamellae making up bone. So just on the side, I just want to make sure you understand what lamella is. And also just note that this is, as we can see on the mandible here, it's on the external aspect of the bone. If I turn this mandible around, I would also see compact bone on the lingual, or what I call the medial surface of the mandible. Okay, like I said, I'll come back to those lamellae. Spongy bone, just as the name implies, has a sponge-like appearance, even with the naked eye. And what in this case, you see this lattice work of spicules of bone separated by these holes or marrow spaces. In a living person, these marrow spaces are filled up with bone marrow. So this lattice-like structure, we can look at the actual spicules of the bone are called trabeculae. So each of these little spicules of bone in here is a trabecula, and they form this lattice work. And if you just apply the adjective for trabeculae, it is trabecular bone. Bone characterized by these spicules of bone separated by marrow spaces. And then, like I said, these marrow spaces are, in a living person, are going to contain bone marrow. And remember, there's yellow marrow that actually has fat, and there's red marrow that actually has hemopoietic tissue. What that means is blood-forming tissue. All of our cells that are in our blood originate in the bone marrow. Okay, now this is, if you notice, this bone was cut open so that we could see that the inside the bone is spongy. It's not dense solid bone or compact bone like it is on the outside. it's spongy in the internal aspect. So why is our bone designed this way? If our bone was completely compact bone, we would be much heavier. It would be too heavier for us. So we just have that compact bone on the outside like a coat of armor. And then on the inside, the spongy bone lightens the skeletal system and then also as a source is where the bone marrow is, where all of our blood cells are produced. The stem cells or those precursor cells of our bloodline is in the bone marrow. Okay, so that's just a general comparison of spongy bone and compact bone. And this is just showing you a close-up. You can really see that lattice work and then these marrow spaces. And this is just a simulation of a model that would have the bone marrow in those marrow spaces. And this happened to be, this is an actual mandible that broke, and I kept it broken because it actually shows you the nature. You can see the compact bone on the buccal here, the compact bone on the lingual, and in the middle you can see the spongy bone. You can see those spicules along with those marrow spaces. And this is just microscopically showing you, here's dense solid bone on the outside on both sides. And then again, we can see the spongy bone in an internal aspect. This is just a close-up of compact bone, and a close-up of the spongy where we just see those, here's solid dense bone, although it does have blood vessels in it. And these are the trabeculae or the spicules of bone separated by the marrow spaces. Okay, I just want to, in that section under longitudinal versus concentric lamellae, that's listed under compact bone, I'd like you just to make sure you understand what lamellae are. Lamellae are just layers of what we call mature bone. So each of these little sections here represents a lamellae. So here, if I just, here's a layer, and then here's another layer. So mature bone forms in this manner. And depending upon the orientation of the lamellae, there are two different types. There are longitudinal lamellae and concentric lamellae. So it's just going to have you draw the two. Longitudinal are like layers of plywood. And they're usually located more on the outside where they have to have their blood supply from the outside. So here not very straight, but I drew in 3 lamellae. 1, 2, and 3. And their blood supply is usually on the outside in the periosteum. So I'm just going to go ahead and draw the blood supply right there. So generally on the outer aspect of compact bone, we have longitudinal lamellae, where the blood supply is on the outside in the periosteum. Deeper in the compact bone, there are blood vessels. Bone does have a blood supply, and I'm just going to draw a central blood vessel. So where there is a blood supply, instead of layers forming lengthwise or longitudinally like plywood, concentric just means in a circular fashion. So the bone is going to form in this circular fashion. So here we have, just going to draw. So I have 1, 2, and 3. That entire, so the 1, 2, and 3 represent the layers or the concentric lamellae. This whole unit is called an osteon or a Haversian system. You may have heard that, remember that term from dental anatomy. So that's, AMP. So it's an osteon or a Haversian system. Right here on the left, this picture shows us part of the concentric lamellae of a Haversian system. The blood vessels not shown there. Okay, so compact bone is made up of longitude. We know compact bone is on the external aspect of the bone. The most external lamellae are longitudinal because their blood supply is in the periosteum outside the bone. Deeper in the compact bone, we have concentric lamellae that form around a central blood vessel, and collectively the blood vessel with the concentric lamellae is called an osteon or a Haversian system. So we'll see both in types of lamellae in compact bone. In spongy bone, we're just going to see little sections of the bone, so we can't make out these complete longitudinal lamellae or concentric lamellae. So there are different microscopic preparations to study bone. This shows one type of preparation where the lamellae are longitudinal. And then right in this picture, this is showing you longitudinal lamellae in the alveolar bone. Now you'll think, well, those don't look like nice straight pieces of plywood. They're kind of wavy like this because bone is constantly changing and remodeling. Here's a close-up of here's one of those concentric lamellae with the central blood vessel. It has India ink in it, so that's what we're seeing over here. You can see the circular pattern of the concentric lamellae, and the India ink is filling up the central blood vessel. And in a different kind of preparation, again, we can see the concentric lamellae surrounding the central blood vessel, and then here we can see some as well. Okay, so I just wanted to review the differences between compact and spongy bone, and they are going to apply to the alveolar process. Okay, let's go ahead and go to the second page of the outline. Now remember when I introduced the tissues of the periodontium, the alveolar bone is not going to be visible. So it's not like you're going to actually be studying the alveolar bone on x-rays. Just like I mentioned last week, you'll be observing the periodontal ligament space on the x-ray. So here, all of this in here, you can see surrounding and supporting the tooth roots is the alveolar bone or the alveolar process. Okay, so let's look at using that image of the tooth in situ. And if you don't have your outline, it would be helpful if you just maybe took the picture that you have in the periodontal ligament section and label the alveolar bone with it. So we're going to be looking at these Remember, this is a buccal lingual view of the tooth, and this is a mesial distal view of the tooth. All right, so looking at this diagram, let's just remember our definition for alveolar bone or alveolar process. So we're going to compare. There are two main regions that we can break the jaw bones into. We can break it down into the basal bone and the alveolar bone or the alveolar process. So just as we wrote the first day of class, the alveolar bone or the alveolar process is the part of the jawbone that surrounds and supports the teeth. And I'm not going to have you color this in at this point, but just all of this represents the alveolar bone. So we're going to look at these boundaries more closely, but just think what's that most coronal boundary of the alveolar bone called? Daisy, do you remember what that's called? Well, that's called the alveolar crest area. So I want you to see it extends, the alveolar process or the alveolar bone extends from the alveolar crest at its most coronal boundary. And I'm going to draw an imaginary line right here. And it extends just a little bit beyond the root tip or apices. Okay, so the coronal boundary of alveolar bone is the alveolar crest, and the apical boundary is the apical area of the tooth, or what I mentioned last week is called the fundic bone, and that's where those apical PDL fibers attach to the bone right in here. Okay, apical to the alveolar process or alveolar bone is what is called basal bone, and we'll get to that momentarily. I just want to show you that, in order, if we kind of estimate where the alveolar process is, we have to just kind of draw that imaginary line here, and all from the crest down to where we estimate the apices, that's where the alveolar process is. Where the mandible's broken, I can show you that just right in here, from the here through here, is the alveolar process. The rest of this, and I'm just going to show in a different color, is the basal bone. And I want to emphasize that in order for us to have the alveolar bone or an alveolar process, there has to be teeth present. When teeth are first developing, the alveolar bone is triggered to develop. So even when the tooth bud is down in the jaw, the alveolar bone is going to start to develop. But I just want to emphasize that teeth must be present in order to have an alveolar process. When patients lose their teeth, look at these photos, there's loss of the alveolar bone. So right where this tooth is missing, here's a complete, the alveolar process resorbs a little bit when the teeth are missing. That's why it's best to get a denture as soon as possible after tooth extraction, so that there is enough alveolar process left to support the denture. So we can see like a really reduced height of the alveolar process in the maxilla and the mandible when there is tooth loss. So it actually resorbs. The alveolar process resorbs. Remember I said resorption just means the destruction of a mineralized tissue. So let's look at basal bone on your picture on the outline. If I draw that imaginary line all the way down to the inferior border of the mandible, and it may be even longer than shown on this diagram, your basal bone is, we can simply define it as the foundation of the jawbone apical to the tooth roots. So in between the interrupted line and in this case, the inferior border of the mandible. I'll show it to you on the actual mandible and the maxilla momentarily. So again, the alveolar process ends apically in that fundic bone area or that apical area. I just want to show you on this, here's an x-ray that shows they have the blue line here. They're showing you the alveolar process in this case of this patient was 3 to 5 millimeters, and that how much more basal bone there is there, which is actually longer than the alveolar process, 5 to 7 millimeters. And again, just with this broken mandible, we can see the same view. That's the dividing line, the alveolar process coronally, all the basal bone apically. So again, if I just look at a mesial distal view as shown with the mandible here, again, I have to create that imaginary line where the apices of the teeth are. In the anterior, the bone's thinner, so I can kind of see those apices. So all of this from the crest to the apical area is the alveolar process, and then apically is the basal bone. So all of this would be the basal bone. I can, when a mandible's been cut open, this is a special jaw that I had ordered to show that cuts away the compact bone so we can really see the apices there. So all of this from the crest to the apical area is the alveolar process, and then the rest of this is the basal bone. Same is true for the maxilla. There are other processes, again, that you're going to study in head and neck anatomy, but we're just focusing on the alveolar process. So right here would roughly be the alveolar process, and then apical to it in here would be the basal bone. Or if I just look at this picture, I can see this apical area. This would be the basal bone going across there. This picture is just showing you that sometimes when you're going to learn more about implants next year, but where there's alveolar bone left, they can often do just a regular implant or what's called a crestal or conventional implant. And sometimes when there's this model here is a model of a patient who's had a lot of alveolar bone loss, and then here's an example of an implant where they just place it in the basal bone. And I did want to just show you that when alveolar bone is lost because a tooth has been extracted, often the patient actually has to get a bone graft in the area to have enough bone to support a conventional implant. So this is just kind of showing how where the grafting would be, and then later on how the implant structure integrates with the bone over time. That usually takes a couple of months to occur, and then a patient will uh, have this crown or superstructure added to the implant. And this is just showing you how they have to uh, get more bone in here. So there's actually a bone graft that was placed, and then those implants. And this just shows you after they put the crown back on how they were able to have more alveolar bone to integrate with the implant. Okay, let's look at the alveolar bone or the alveolar process more closely. We can break alveolar bone down into two main areas. We can break it down into the what's known as alveolar bone proper and then supporting alveolar bone. So if we look at our picture here, the alveolar bone proper is a thin plate of compact bone lining or forming the tooth root. So if I just, you can see this dense solid bone lining the tooth socket right in here. That is the alveolar bone proper. If I took that tooth out, you would just see this thin, compact bone. Even though it's thin, it's still made up of compact bone. And I want you to think of like the thickness of an eggshell. An eggshell is solid and dense, but it's very thin. It's best to picture it that way. We're also going to see that this is where it's the part of the alveolar bone into which the Sharpie's fibers from the principal fibers of the PDL attach. So for example, if I just, right here, the Sharpie's fibers are going to specifically insert into the alveolar bone proper on the alveolar bone side. They don't go all the way into the supporting alveolar bone that I'm going to define next. Okay, supporting alveolar bone is the rest of the alveolar process, excluding the alveolar bone proper. So as a definition, we would say that it's the alveolar bone that surrounds the tooth socket, providing additional support to the teeth. So I'm going to go ahead and just I accidentally just show the alveolar bone proper on this side, this solid bone right along here. And then the rest of the alveolar process is the supporting alveolar bone. So if I just in this direction go from here horizontally, that's all the supporting alveolar bone. From here to here. Okay, but if you look at this diagram, where I have the bar, the purple bar, you can see part of the supporting alveolar bone is spongy, but if I go to the outer aspects, remember this is the, trying to get the, this is the buccal side, this is the lingual side. Notice if I move away from the tooth root, I'm in spongy bone, but then back on the outside here, there's compact bone. So supporting alveolar bone can be divided into two parts: compact, or also known as cortical bone, and spongy, or also known as cancellous bone. So let's write in some definitions, and the definitions actually just fit the definition for compact bone. It consists of dense solid bone that's on the external aspect of the jaws, the buccal or the lingual. So right here where you see dense solid bone along here, that's the compact supporting alveolar bone. And on the lingual, it's also right along here. And like I said earlier, that compact bone are also known as the buccal and lingual cortical plates of the jaws. They're dense, solid bone, compact bone. And then again, I just want to emphasize that when I was talking about the gingival fibers and the blood supply to the PDL, remember the buccal and lingual bone is covered by a periosteum, a dense fibrous connective tissue that has a blood supply and nerve. If any of you have noticed sometimes if you've been probing on the posterior teeth and you're trying to use your mirror, if you get that mirror edge on the bone, it's very sensitive. It's because of that periosteum that covers the bone. It has sensory nerves in it. Okay, so the rest of this, where you see the spicules of bone separated by marrow spaces, is the spongy supporting bone. So again, just the definition of spicules of bone separated by marrow spaces as seen in the picture. We can see these holes here are the marrow spaces, and then we see this lattice work, these little spicules of bone throughout there. So they're located on the internal aspect of the jaws between the cortical plates. So again, that fits the definition for spongy bone in general. So on page 3 of your outline, you have this picture. So the best way to remember what order the bone is, these three regions of alveolar bone, is just find the tooth root right here, find the periodontal ligament, and then immediately what's shown in yellow is that thin plate of solid bone lining the tooth socket. So that would be our alveolar bone proper. And then as we move away from the tooth root, you just remember it that way, you won't get mixed up. As we move away from the tooth root, in between here, you can see the spicules of bone separated by the marrow spaces. So number 2 represents the spongy supporting alveolar bone. And then again, as I move to, this is toward the lingual, here's the buccal. So if I move away, notice I'm back to compact bone again. So here's where your compact supporting alveolar bone is located on the outside. So closest to the tooth root and the periodontal ligament is going to be alveolar bone proper. As I move away from the tooth to the external parts of the jaw on the buccal and the lingual, there's spongy supporting alveolar bone and then compact or cortical supporting alveolar bone. This picture also shows you what I mentioned earlier, that this Sharpie's fibers. This shows you those different principal fibers. Notice that the Sharpie's fibers insert just into the cementum on one side and then into this yellow thin plate of alveolar bone proper. These are all the Sharpie's fiber ends connecting the PDL to the alveolar bone. So now you know that the PDL specifically attaches to the alveolar bone proper. It does not attach to the supporting alveolar bone. Again, this just kind of shows you microscopically. You have this picture on page 3 too, but it shows you, we labeled this in our PDL lab, as we call those end pieces, those Sharpie's fibers insert into the alveolar bone proper. So all of this is actually showing you the alveolar bone proper. And you may think, well, that looks really wide. That doesn't look like a thin plate, but you have to realize that it's a magnification. It's still very thin as represented on the diagram to the right. Okay, I'm going to come back.
Could you go back to the slide before?
This one with the definitions?
Yeah, please.
Okay, sure. Okay. Just want you to see that.
Yeah, I'm good now.
Okay.
Thank you.
I'll come back to this. All right. So I just want you to see that on the, look at all on the outside of the